Here are the 7 best treatments for knee pain from Chondromalacia Patella. Number 1 is avoiding anything that hurts. Now, this might seem like common sense, but you'd be surprised how many people get told to do an exercise that is for Chondromalacia Patella, but it actually makes their knee hurt. Now, it could be that that exercise is a good Chondromalacia Patella exercise at a later time when you're not as flared up. But if it's hurting you right now to do any sort of exercise, good or bad, you should not do it, because that pain is your knee telling you that this is not good for it right now. It's not ready to take these forces in your knee joint right now. So you shouldn't be doing it right now. You have to listen to your knee and avoid anything that makes it hurt worse. The second treatment that is amazing for Chondromalacia Patella is glute strengthening. Getting the butt muscles, the glute muscles stronger is key. It is extremely important at making sure to offload the excessive forces that are going through your knee if you have Chondromalacia Patella. Now, you have to look at it through this lens. Chondromalacia Patella happens as a result of too much force from the kneecap against the thigh bone, and it's coming from a muscle imbalance. And that muscle imbalance is usually that the quad muscles are too strong, and those quad muscles attach into the kneecap, and when they pull hard, they pull the kneecap up against the thigh bone, and this causes excessive compression, too much force through the cartilage behind the kneecap and on the end of the thigh bone. And if you can turn on the glute muscles better and get them stronger and begin to use them with your everyday activities and definitely during exercise, then you'll be offloading that patella and getting your Chondromalacia Patella to improve. Treatment number 3 is using a massage gun like this on your thigh muscles. The reason for this, the reason why this is so good for you, is because usually those quad muscles are over dominant and too strong, and that's why they're compressing the cartilage in the knee, and as a result they can get stiff and tight. And if you can loosen it up with a massage gun like this, then you can begin to relax that quad muscle and take pressure off your kneecap. Now, any form of massage could be helpful for this, but I find that this tends to be the most efficient, so your hands don't get too tired. You're not having to go see a massage therapist all the time or any other specialist that's doing it for you, but it's totally fine if you want to use any other methods to loosen up the quads on the front of your thighs. These are pretty affordable these days though, and they're handy and they get the job done very well. Number 4 is strengthening your abdominals. Let me give this over there. When you get your abdominals stronger, it allows your spine to be more stable, which makes your hips more stable, which gives you a stable platform to work from for your knees. All the muscles that attach up in your hips and affect the knee, which there are a lot, they can have a much more stable foundation to work from so that your knee joint is going to be operating at its best potential. When you have those core muscles stronger, and your abs especially, then your glutes have a better chance of being strong, and it takes the pressure off your chondromalacia, off your kneecap, so that you're not compressing and shrinking down the cartilage behind the kneecap. Number 5 is strengthening your toe flexors. These are the muscles that can curl your toes. The reason for this is because if you can get stronger toe flexors, those muscles, they have tendons that go into the arch of the foot. It can help you to restore your arch, especially if you have fallen arches or you tend to flatten out on your arches whenever you stand up. That flat arch will cause your ankle to tip inward, and then it can cause your shin bone below your knee to tip inwards, which affects your knee and can affect the way the kneecap aligns on your thigh bone. Getting strong toe flexors can straighten all this out so that your knee joint has the best forces going through it, and you're not irritating that cartilage behind your kneecap. Number 6 is walking with your glutes. Now, what I mean by this is most people don't think about how they're walking, what muscles are using when they're walking, but if you can make yourself tighten up your glute muscle every time you walk, then you can take pressure off your knee joint every time you walk. This is important because when you take a step, you're tending to use your quad muscles to bear your weight onto that leg and progress yourself forward through the walking motion. But if you think to instead use your glute muscles and try to relax your quads, they won't relax completely, but if you can make your glutes work more than your quads, then you're going to be taking pressure off that kneecap and giving that cartilage behind the kneecap space to move without getting over compressed. And if you do this consistently, especially if you're walking for exercise or you have a lifestyle where you're just on your feet more and you're walking more, and you can make this part of your normal way of walking, then you're dramatically reducing the bad forces going through your kneecap, which is going to put you in a position to heal your chondromalacia patella and avoid having to rely on medications, injections, and definitely avoid surgery. Now, real quick, the way you do this is when you put weight on one leg, you need to think about tightening the glutes only on that side. And then as you shift your weight onto the other leg, relax the side you're on first, and then tighten the glute on the other side. And it should feel like you're walking by alternating your glutes. Number 7 here is fix the muscle imbalances. Now, I alluded to this earlier back when I was talking about the glutes. You have to see chondromalacia patella as caused by a muscle imbalance. Many people think that it's caused by age or by some specific sport activity, but usually it's that your muscles are working in the wrong balance, and it's causing your quads to put too much force on your kneecap, and it's rubbing down the cartilage, it's compressing the cartilage, and then if you exercise a lot, it's rubbing it down, and that's what's causing you swelling, pain, and stiffness in your knee. That's what's keeping you awake at night. It's irritated, and if you can take that pressure off your kneecap by fixing the muscle imbalances, then you can have a long-term resolution of this problem and prevent worse problems like knee arthritis when you're older or meniscus injuries. If you're wondering how to fix the muscle imbalance, I talk about it at length on my YouTube channel here. I've got a playlist for you. You can find it down in the description. It's called Chondromalacia Patella Help. And I've also got a program called the Patella Pain Recovery Program. It's a comprehensive program that walks you through our strategy, our treatment approach, step by step to fix problems like chondromalacia patella and other patellar related problems. Now, this program can be accessed from anywhere you have an internet connection, and it's on demand, so you can get into it right now, anytime you like. Please go down into the description below to check out the link for the Patella Pain Recovery Program and see if it's right for you. If you found this video helpful for you, then please give us a thumbs up. Please consider sharing this with somebody you think needs to hear about this. And please drop a comment below. We love to see your comments and answer them as best as possible so that we can point you in the right direction and give you the best information you need to make the next best decision for your knee problem. Thanks so much for watching, guys. Don't forget to subscribe and hit that notification bell so you don't miss out on the next video that we'll post soon. I'll see you in the next video. Bye-bye.